Hello everyone, this is Dr. Shweta Anand and welcome back to my channel Simplified Dentistry. If you have not yet subscribed to my channel, then please do subscribe and click on the notification bell so that you can get notified about my latest videos. In today's video, let's know about Bell's palsy. Bell's palsy is one of the very important questions asked in first year anatomy, and it is often asked to write short notes on this topic. Basically, Bell's palsy is a condition that causes a temporary weakness or paralysis of the muscles in the face. This condition results from the damage to the facial nerve, that is the 7th cranial nerve. So facial nerve is the nerve which supplies muscle function and sensation to the face, affecting tears, salivation, taste, and facial expression. In Bell's palsy, pain and discomfort usually occur on one side of the face or head. So now let's know in detail about Bell's palsy. Bell's palsy is a lower motor neuron type paralysis of facial muscles due to compression of facial nerve in the facial canal near stylomastoid foraman. The exact etiology is not known, but it is probably due to viral infection. Let's have a look on some of the clinical features on the side of paralysis. First is facial asymmetry. The affected side is drawn to the healthy side. It occurs due to unopposed action of the muscles of normal side. Second is loss of horizontal wrinkles on forehead, which occurs due to paralysis of occipitofrontalis muscle. Third is widening of palpebral fissure and inability to close the eye, which occurs due to paralysis of orbicularis oculi. Fourth is tears flow down from the eye, which is termed as epiphora, and it occurs due to paralysis of the lower part of the orbicularis oculi. Fifth is sagging of the angle of the mouth towards the affected side and inability of the angle of the mouth to move upwards and laterally during laughing, and it occurs due to paralysis of zygomaticus major. Sixth is loss of nasolabial furrow, which occurs due to paralysis of levator labii superioris aliquinizi. Seventh is accumulation of food into the vestibule of the mouth, and it occurs due to paralysis of buccinator muscle. Eighth is dribbling of saliva from the angle of mouth, and it occurs due to paralysis of orbicularis oris. Ninth is loss of resistance when one presses cheek with inflated vestibule and air leaks out from between the lips. It occurs due to paralysis of buccinator muscle. 10th is pain in the ear, which may precede or accompany the nerve paralysis. 11th is some complaint of noise intolerance, that is stapedial paralysis, or loss of taste, that is involvement of chorda tympani. So this was all about Bell's palsy. Thank you for watching the video, and if you liked the video, then please don't forget to like, share and subscribe to the channel.